Hello, I am Dr. Andrology, Director of Krishna. We are an assisted reproductive center in a city called Visakhapatnam, which is in the state of Andhra Pradesh in India. And we would like to share in the next 10 minutes the work which we have been doing in the field of assisted reproduction and more so in the field of andrology. One would wonder, what is Leeuwenhoek doing in this image? You should be surprised that Leeuwenhoek, using this small piece of microscope, which does not look like the conventional microscope, could identify a variety of sperm abnormalities which we are not even using it by most of the reproductive medical people, be it the andrologists, the gynecologists and the urologists. In the next slide, you will be seeing how nearly 400 years ago Leeuwenhoek has described the morphological abnormalities of the sperm. In this slide, where you are showing how Leeuwenhoek was able to describe the different types of sperm morphology that are there. When you look at the sperm heads that are there in the diagram, he could describe sperms with larger heads, sperms with irregular heads, sperms with smaller heads and double heads. In spite of 400 years of the grand work, Leeuwenhoek did it. Today, most of the time when we visit an IVF clinic or an infertility clinic, seldom a male is examined and a proper analysis is not done. Hence, a lot of people suffer with an improper evaluation. And in the years together, with the changing life cycle, there is an emphasis about the role of obesity in the male. In the female obesity, the issues are very, very clear. If the woman is obese and the body mass index is more than 30, they have a decreased chance of conceiving. In fact, when you look at the UK government policy of the NIH, if the woman's body mass index is more than 30, they are not eligible for free IVF cycle in UK. That speaks about the effect of obesity in the female. What about in male? Very few studies are there and the information is scanty. We did a pioneering work in which we used 2 or 3 types of tools. One is an infertile clinic setting in which we studied the difference between the sperm parameters in the male in relation to obese and non-obese, and then we further subdivided them into diabetic and non-diabetic, health related and non-health related, and we found information which has a longer message to the society at large. The advances in computer-aided seminal analysis has helped us to understand that computer-aided analysis gives a much more precise, reproducible information. That reproducibility is a very important component in the analysis of the male. When you look at this image of the sperm, most of the time it is not documented, it is not properly measured, and also it is not properly reported. In this situation, when we look at the current information, wherein the advances have happened so much that you have people measuring the sperm head, width, length, area, circumference as seen in this slide. This is an area where all of us are lacking in looking at and identifying this information. So when we look at the analysis, what did we find? If the male is obese, there is a change in the testosterone levels, there is change in the alteration of the estrogen levels, the effect of metabolic profile abnormalities together with ill health will have a drastic effect on the sexuality and in the fertility of the male. How are semen analysis done? The semen analysis is done by the conventional semen analysis tools or by CASA tools. Each of these tools have their own advantage and disadvantage. What did the good scientific workers feel about the CASA? They felt that CASA should be widely be used so that there is reproducibility of the result and then quantification of the results. In this scenario, that is where we did this study, wherein we studied 1280 people, of which around 200 were obese, and in this we studied the effect of concentration, the volume, the motility and the quality, and looked at how it affects these parameters when the couple are obese and when the couple are not obese. And then we used the statistical tools to look at these parameters, wherein we compared the percentage, the mean values, the median values and the standard deviation. We also did a linear logistic regression and also used the adjusted and unadjusted models to produce a robust statistical model which can stand the scrutiny of the scientific community and the peer review process. We were lucky to have this accepted for publication in the Journal of Andrology, which is being published in the month of October 2017. In this information, what we found was, in the study population, we found there was a 12% incidence of obesity in the obese group, and in the non-obese group, the abnormalities were 6%. Obese people had more abnormal counts and abnormal motility. In addition to that, if the obese people had associated diabetes, it was much worse. They had lower volume of semen, lower motility, lower quality, and higher DNA fragmentation. This is producing a drastic effect. What is the carry home message from this information? The carry home message is there is an important tool called CASA which will help us to evaluate semen analysis in a better way. Second thing is, sperm kinetics are significantly affected in male factor infertility, which in terms of the velocity of the sperm is altered. In turn, it takes longer time to go. When you are looking at the sperm morphology, you are seeing this morphology of the sperm. When it is measured by a good accurating tools, it affects the quality of the sperm. This is an image how it looks like when you are using a morphological study using CASA, wherein the length of the sperm, the width of the sperm, the area and the perimeters are seen. This is how the report looks like, wherein you have around 200 sperms assessed with the length, width, area, perimeter, ellipsity, the angle of the midpiece, the size of the midpiece, and it gives a comprehensive information as seen in the information. When you use this tool, it produces a good quality image. A closer view of the same thing, wherein you are able to see the sperm head, neck and tail. What is the implication of this work? The implication of the work is male partner's health is equally important in reproduction. Second thing is, if you are obese, improve your health before you go to a fertility clinic. If you are failing in treatment and you are obese, reduce your weight, improve your health. If there is associated diabetes, correct the diabetes, which will in turn help you to get the pregnancy at a shorter interval. Key message of this study is, people blame the woman and the obese woman, But what is forgotten is male obese also produces infertility, and male obesity with diabetes makes things worse. And if you have obesity and diabetes, you should improve your health before you approach a fertility clinic. That's the carry home message of this whole study and the presentation.